Chronic disease remains a salient health and economic concern in the United States, as almost half of all Americans are impacted by at least one chronic disease. Past studies have shown the contributions of social determinants of health to chronic disease. The Robert R. Frank Student Run Free Clinic has served the diverse medically uninsured and underinsured Detroit population since its inception in 2010. Despite providing free healthcare service for almost 15 years, data regarding our demographics and common chronic diseases amongst our patient population has never been quantified nor explicitly defined to date. This study aims to qualitatively describe the prevalence of chronic conditions observed amongst the uninsured patient population seen at SRFC to better cater our services to the illnesses they are suffering from the most. We also aim to examine any associations between these conditions and socioeconomic factors most common amongst our patient cohort. We will also assess any racial or gender disparities amongst our collected data. By identifying the most chronic diseases and their association with socioeconomic factors, this study will help inform future initiatives to improve healthcare at SRFC. Understanding these patterns is essential for developing targeted interventions, optimizing resource allocation, and ultimately enhancing the quality of care provided to Detroit's underserved communities. Our findings aim to contribute to a more equitable and data driven approach to managing chronic illness within student free run clinics and similar healthcare models nationwide.
Our methodology included a retrospective chart review with inclusion criteria of patients over the age of 18 and those who were treated at SRFC from 2018 to 2024. Data was extracted from SRFC's EMR called Practice Fusion, and it included patients who were diagnosed with chronic conditions, including hypertension, hyperlipidemia, amongst others. Diagnoses was based on ICD-10 codes notated in patients' medical records. Data was descriptively summarized by means, medians for demographic variables and chronic conditions. No formal hypothesis testing was performed in our study.
In regards to results, Table 1 depicts the characteristics of the study population. Between 2018 and 2024, a total of 108 patients met the inclusion criteria. The population primarily composed of middle-aged to older adults. The majority fell within the ages of 45 to 64, 55.6%, followed by those aged 65 and above, 29.6%. The mean age was 57.5%. In regards to race, the population was predominantly African American, composing of 81.8%, represented later than by Caucasian, Bengali, and Asian communities, which is pretty reflective of the Detroit population. Table 2 shows the most prevalent chronic conditions stratified by gender. Diabetes and hypertension are the most prevalent conditions among the patients overall, 57.6% and 45.4% respectively. Gender-specific analysis showed that diabetes was slightly more common among male patients, 59.3%, compared to female patients, 55.6%. Whereas hypertension had a higher prevalence in females, 50%, than males, 40.7%. Depression impacts 17.6% of all patients, predominantly affecting females, 24.1%, compared to males, 11.1%. Arthritis is notably more common in females, 13%, relative to males, 1.9%, and COPD affected only females, 3.7% in this sample.
Based on the results of our study, we recommend programs to implement within free clinics. The first one being patient education to provide culturally and socioeconomically sensitive education on diabetes and hypertension management, promoting realistic lifestyle changes. The second one being medical student training, developing programs to equip students with practical knowledge on addressing diabetes and hypertension within the context of social determinants of health, as well as elderly-focused screening, offering in-house screenings or refer patients to local resources for age-appropriate preventative care, including colorectal, mammogram, and prostate exams, as well as senior-centered support, so educating students on assisting aging patients with navigating Medicare, Social Security, and safe exercise routines tailored to their abilities. We would also like to thank Robert R. Frank Student Run Free Clinic for allowing us to utilize their Practice Fusion EMRs to collect data and make this project possible. We would also like to thank Dr. Rhonda Daly for being the study's faculty and Dr. Williams, the SRFC Medical Director, for his guidance and encouragement in this project. Thank you.